Hello everyone. In this class, we'll try to study about the normal electrocardiogram. The learning objectives would be to classify ECG leads, appreciate the importance of Enthoven's triangle, draw a label diagram of lead to ECG and identify the ECG waves, segments and intervals, define and give normal values and significance of various ECG waves, segments and intervals. In modern electrocardiography, two types of ECG machines are used. One is string galvanometer and another one is radio amplifier. The ECG is recorded on ECG paper fitted in the machine. The ECG paper is a strip of graph paper that contains vertical and horizontal lines 1 millimeter apart. The horizontal axis represents time, whereas vertical axis denotes the amplitude. There are heavy lines every 5 millimeters in both the planes. Thus, there are small squares of 1 mm into 1 mm and big squares of 5 millimeter into 5 millimeter. The ECG paper is heat sensitive plastic coated paper. The ECG is inscribed on this paper by hot stylus. Conventional ECG is taken at the speed of 25 millimeters per second. One small square, that is 1 mm, corresponds to 0.04 second, while the big square 5 millimeter is equivalent to 0.2 second. ECG leads. An ECG lead is a pair of electrode used to detect the potential difference of the heart. The ECG leads are broadly classified into two categories that are direct leads and indirect leads. Lead directly applied on the surface of the heart are direct leads, and where leads are applied away from the heart, usually on the body surface, they are indirect leads. Indirect leads are limb leads, chest leads, and esophageal leads. Conventionally, 12 lead recording is usually done. Uh, so usually 12 lead recording is performed for the complete analysis of the ECG. The leads are connected in the two planes that are perpendicular to each other. One is the frontal plane that defines 6 limb leads, and other is transverse plane that defines 6 chest leads. Coming to the limb leads, there are two types: bipolar leads and unipolar leads. Bipolar lead records the potential difference between two electrodes placed at different sites, whereas unipolar lead giving the potential difference between an exploring and an indifferent electrode, that is a reference input. The reference input comes from the combination of two electrodes at different sites that roughly gives a zero potential. Bipolar limb leads. Three bipolar standard limb leads, that is lead 1, lead 2, lead 3, to record the electrical potential on the frontal plane. In the method of recording bipolar leads, two electrodes are placed on the body surface and the potential difference between these two electrodes is recorded. Electrodes are attached to the right arm, and left foot as indicated in the Enthoven triangle. And ground wire is applied to the right leg to prevent external disturbances. The lead 1, it calculates the potential difference between right arm and the left arm, whereas lead 2, it is between right arm and the left leg, and the lead 3 calculates the potential difference between the left arm and left leg. So Enthoven triangle is an inverted equilateral triangle with each side representing the axis of one of the bipolar limb leads. So heart is considered to be present at the center of Enthoven triangle. Each corner of the triangle serves as a location for the electrode for two leads to the ECG recorder. So thus, three limbs of the triangle represent three leads. Electrode causes an upward deflection when it is under the influence of positive dipole relative to the electrode. Enthoven triangle is also used in calculation of mean QRS axis of the heart. So this diagram showing the Enthoven triangle with the different limb leads. So this is limb bipolar lead 1, lead 2 and lead 3. So lead 1 between left arm and right arm, lead 2 between right arm and left leg, and lead 3 between left leg and left arm. Unipolar limb leads. In the method of recording unipolar leads, one electrode is active or recording electrode and the other is indifferent electrode. Three unipolar limb leads, that is AVR, AVL and AVF. The potential recorded in AVL is 1.5 times more than that of the recorded in VL, and similarly for AVR and AVF. Therefore, these leads are called as augmented leads. So augmented limb leads are AVR, AVL and AVF. This is going to record the potential between the right arm and the combination of the left arm and left leg, which acts as a negative electrode. AVL, it is the potential difference between left arm and combined right arm and left leg. Whereas the AVF, it is the potential difference between left foot and between the combination of right arm and left arm, that acts as a negative electrode. Chest leads or precordial leads lie in the transverse plane. There are two types, unipolar and bipolar chest leads. Unipolar chest leads, there are 6 precordial leads. They are designated as a V1 to V6. V stands for unipolar. The reference or indifferent electrode is connected to right arm, left leg through the high resistance, so which is called as Wilson's terminal, that is maintained at zero potential. The right leg is connected with a grounding electrode. So these are different position of the chest electrodes. So V1 is situated on the right fourth intercostal space at right border the sternum, V2 at left fourth intercostal space at left border of the sternum, V3 uh, is midpoint between V2 and V4. V4 is the left fifth intercostal space on the mid-clavicular line, and V5 is left fifth intercostal space on anterior axillary line. V6 is left fifth intercostal space on mid-axillary line. So there are other chest leads, V7 to V9, that are also used in special occasions. That is, V7 will be placed on the left fifth intercostal space on posterior axillary line, whereas V8 on the left fifth intercostal space on posterior scapular line. Bipolar chest leads records the differences of potential between any given position on the chest and on one extremity. Levi's lead is a special bipolar chest lead that used for recording the ECG in atrial arrhythmias. So this lead amplifies the waves of atrial activity. So there can be esophageal leads. So in these leads, electrode is fixed on the tip of the esophageal catheter, so which is positioned on the esophagus close to the heart chambers. So A1525 used for the recording activity of the right atrium. E2535 is used for the recording activity of the AV groove region. E40 to 50 used for recording the activity from posterior surface of the left ventricle. And the numericals denote the distance from the incisor to the catheter, tip of the catheter. Coming to normal ECG, the ECG tracing shows the different waves, segments and intervals. Waves are the positive or negative deflection from the baseline. So there are 4 waveforms: P wave, QRS complex, T and U waves. P wave is the first positive deflection in ECG produced by atrial depolarization, whereas QRS complex consists of QRS waves produced by ventricular depolarization. Q wave is the initial negative deflection in the QRS complex, R wave is a positive deflection in the QRS complex, S wave is the second negative deflection in the QRS complex. And T wave is a positive deflection produced by ventricular repolarization. U wave is a final positive deflection in the ECG. Normally, this wave is not always present. It occurs due to the slow repolarization of papillary muscles. There are different segments. So segments are the isoelectric lines on the ECG tracing. So there are two segments, PR segment and ST segment. PR segment lies between the end of P wave and beginning of the QRS complex. ST segment lies between the end of QRS complex and beginning of the T wave. J point is the point where the QRS complex ends on the ST segment begins. And the importance of J point is it is elevated in myocardial ischemia and myocardial infarction. Intervals are usually they include waves and segments. So there can be different intervals, PR interval and QRS interval. PR interval is between the beginning of the P wave and beginning of the QRS complex. Its normal duration is 0.1 to 2.2 second. It shortens as the heart rate increases. The significance is this represents the atrial depolarization and conduction through the AV node. QRS interval from the beginning of the Q wave or R wave if Q is absent to the J point. The duration is 0.8 to 0.1 second. This represents ventricular depolarization. The atrial repolarization also occurs in this period. QT interval is from the beginning of QRS complex to the end of T wave. Its normal duration is 0.4 to 0.43 second. Significance is it represents ventricular depolarization and ventricular repolarization. ST interval is between J point and end of T wave, so this is calculated by deducting QRS interval from QT interval. Its normal duration is 0.32 second and it represents ventricular repolarization. PR interval is between either the peak or the beginning of the two successive PP interval. The PP interval is measured for the calculation of the atrial rate, whereas RR interval is between two successive R waves. RR interval is measured for calculating the heart rate, that is the ventricular rate, and RR wave is used for the assessment of heart rate variability. So this is the diagram showing different waveforms of ECG. You can see P wave, QRS complex, T wave, and U wave. And there are different segments that are PR segment and ST segment, and there can be different intervals such as PR interval and QT interval. Okay. This is another diagram showing comparison between the surface recording of the electrode and the ventricular action potential. So this is about in brief about the ECG, that is electrocardiogram. Thanks for watching.